Tell them what you're feeling. Tell them what you're experiencing. And mom and dad should listen with empathy, not trying to fix anything. That is very, very powerful because the familial support, parents and siblings, will strengthen the resolve and resiliency of that individual, whether prepubescent or adolescent, to be able to deal with society's negative aspects much easier.
What do you really know about people who are born transgender? Have you ever met someone who's transgender? Well, if you're like me, you're curious but hesitant to ask questions. Well, welcome to Demystifying the Transgender Journey. In our conversations with people who were born transgender, their families, friends, and the professionals who support them, we ask probing questions and discover insightful and educational answers. You can also find more information on our website, thetransgenderjourney.com. Now let's get right into today's episode. Well, hello and welcome to another episode of Demystifying the Transgender Journey. Thank you for tuning in and for being part of this community. We're here to explore powerful stories, unique perspectives, and authentic journeys, and we're grateful that we have you with us today. I'm Lynn Murphy, author, speaker, leadership coach, founder of Women Who Push the Limits, and the cisgender half of your host team. Your co-host is Wendy Cole, transition mentor coach specializing in assisting individuals as they navigate significant changes in their lives, because she has navigated a very significant change in her life and transitioned at 67 years old. So it's our goal to provide stories and educational content to help counter the misinformation and the horrendous disinformation that's so prevalent in society today. We strive to humanize the transgender experience by introducing you to real people who were born transgender, their families, friends, healthcare workers, and other allies. And tonight, we are so excited to welcome back to our show Dr. Diana Sorrentino, a nationally recognized expert on gender diversity and transgender identity with dual doctorate degrees in sociology and psychology. She's an affirmed woman and the author of several influential books, including Transgender Families, which is sitting right here on my desk, making her a leading voice in the intersection of science, medicine, and lived experience. So, Dr. Sorrentino, thank you so much for coming back to our show and for sharing your unique combination of decades of research, personal expertise, and your lived experience. And we appreciate very much that we and our audience are learning about gender diversity and transgender identities. So if you would, please share your background, because you are so much better at sharing where you come from and what your experience is than I am.
Well, Lynn, Wendy, consider it an honor or privilege to once again join the two of you to share this very important scientifically and medically based information, as well as what has been learned in the field of psychology over the past 40, 50 plus years. As mentioned, I am an affirmed woman. My life's evolution took place in January of 1990, 35 years ago. I've been researching and studying gender diversity and transgender identities, the neurobiology, the physiology, and the psychology of it all for the better part of 40 years. I've been working with the community as well as training medical and behavioral healthcare professionals for a little more than 35 years. I've written 3 books: Transgender Families, helping parents and families understand gender diversity and being transgender. And that's this title here.
Yes.
2 books currently being published. One is The Neurobiology and Physiology of Incongruent Gender Identities and Sexual Orientation, as well as Adolescent Gender Affirming Medical and Behavioral Healthcare. My approach in discussing this very important topic, whether with medical and behavioral healthcare professionals or the citizenry in civics groups, church groups, League of Women Voters, and the like, is to discuss the factual, medical, and scientific research that has underscored the knowledge we have today of how we become who we are as gender diverse individuals with identities that are incongruent for our sex assignments at birth. Every program I've done, whether for medical professionals or civilians, is like I prefer to refer to the civic groups, is they're awestruck. And what I hear so frequently at the end is, I had no idea. I had no idea. Well, how could you when you have nothing but the media and the hype, myths, pathological assumptions that are thrown about by individuals who have no basis of knowledge? I've had several people in the course of my lectures, live programs, say, well, I don't believe this. This is not so. I said, well, that's fine. Please share with me your research. I would be interested in reading what you have found that counters everything that I've shared with you today. Well, of course, they cannot do that. So I am here to share my knowledge, experience, and my lived experience with being an affirmed woman. As one person shared it so succinctly a little while ago, I have the trifecta. I have the credentials, I have the research and study, and the lived experience. It's a powerful combination.
Well, and that trifecta is one of the reasons that we want you on the show more
Wow.
than once.
Exactly.
So last time we talked about prepubescent children and some of the situations with their parents, and you defined gender. And if people haven't seen that episode or listened to that episode, I invite you to do that. And we will put the link to that in the show notes. So today we want to dig deeper and draw on your expertise and your experience and go into more of the family side of it and the partner side of it. Now, in your book, Transgender Families, a line you use is no one transitions alone. So let's talk about the parents when their child says to them, and you say this in a book, so often you get parents who say, what do I do? What's going on? I don't understand. How do I fix this? Or how do I deal with it? So let's talk about parents. Maybe let's start with younger children who are questioning and then work into parents of teenagers and young people. What's going on there and how do you work with that?
Well, it's not uncommon for me to receive a call, primarily from a mom, sharing with me that their prepubescent child is cross-gender role playing, showing fluidity in gender identity. And they're confused by it. Now, we're talking a prepubescent child under the age of 7, usually between 3 and 5, maybe 6. Well, that is a normal and healthy component of early childhood development. And I'll ask the parent, is your child telling you that they are a gender that is different from their sex assignment at birth? More often than not, the answer is no, they're not. If they say yes, I'll ask, how persistent are they? And we'll get into that shortly because there's a different tact I want to take initially. As I mentioned, cross-gender role play, gender fluid behavior during prepubescence is common and a healthy part of early childhood development. For the non-transitioning child, the individual who is not going to be on the path to transitioning, that behavior dissipates by age 7 and 8 as they start interacting, spending time and more play with their cisgender peers. So the advice I share with mom or the parents, plural, is you ride the wave. Don't interfere. Interference will create emotional problems for the individual. And we're talking about a prepubescent child who is not on the path to being transgender. They could be assigned male at birth, they could be assigned female at birth. Makes no difference because it's going to dissipate many times by age 9. They're looking forward to puberty and the onset of the sexual characteristics that are consistent with their sex assignment at birth, and there's no issue. The caveat to what I've just shared, there are behavioral issues with child, then it would be appropriate to engage the services of a psychologist who is knowledgeable in early childhood development. Because there might be something more going on. If that parent or parents want to come into my counseling office, before I even meet with their prepubescent child or adolescent, I want to learn more about what's going on within the home. The interaction between parents, prepubescent child, the siblings, and the like, to make sure that there's not an underlying issue that might be contributing to the behavior.
So what are parents usually afraid of? Or, what are their fears and their wants for their child when this comes out of the blue sometimes?
Well, again, we're talking about the prepubescent child prior to age 7. If anything, it's confusion as to, well, what does this mean? And the confusion comes into play only because of what they've heard through the media, the myths, the hyperbole, pathological assumptions, the geopolitical arrogance. So they're immediately thinking, oh my God, what's going on here? Now you go back 30 years ago, 40 years ago, 50 years ago, the prepubescent child's behavior with cross-gender role play, it was non-issue because there was no overt knowledge of gender diversity and transgender issues. So for the prepubescent child who is not insistent, consistent, and persistent in their belief that their gender is different from their sex assignment at birth, mom and dad ride the wave, it's going to go away. If there are behavioral issues, they may or may not be related to that behavior. Be with a child psychologist who is knowledgeable in early childhood development. That's the simplest route, not a big deal. Now, when you have that 3, 4, 5-year-old who is outwardly saying, I'm not a girl, I'm a boy, I'm not a boy, I'm a girl, that's a little different. Typically, that will not dissipate and go away at age 7, 8. Mm-hmm. And if anything, as that prepubescent child approaches puberty, they're going to become very anxious about the development of secondary sex characteristics. Now, where the trauma will come in for that prepubescent child is when a parent or parent will tell the child, stop this nonsense. You're a boy, you're a girl. That's the end of the story, and there's no variation. And they basically are dismissing the child. Mm-hmm. That will qualify as an adverse childhood experience and have long-term negative consequences on the physiological and psychological health of the individual. As that prepubescent child who's not supported by the parent, who's being dismissed by the parent or parents plural, dysphoria will begin to increase. They will begin to believe that there's something wrong with them because mom and dad, they're not listening. Mm-hmm. And as they start approaching puberty with that lack of support, the anxiety and the potential for depression increases exponentially. So it's a case-by-case basis.
So what's going on in the parent's head when they, whether it's a prepubescent child or an adolescent child who comes out to them, what is going on between their ears?
For the prepubescent child, the parents are saying, oh, they're looking for attention. They feel like they're not being treated the same as their siblings if they have brothers and sisters. It's a phase that they're going to go through and grow out of. They have a mental disorder. A variety of thoughts will go through their mind. Very few have any rationale for a child who feels they're different. Mm-hmm.
Well, we hear some parents are concerned that they, as parents, did something wrong. Do you see that in your practice too?
Well, if the parents are being supportive of the prepubescent child or the adolescent, and they come to the realization that this is a true self-attributed identity, which is incongruent with the sex assignment at birth. Oh, I hear that quite frequently from moms. What did I do wrong when I was pregnant? Nothing. What did I do wrong as a parent? Nothing. This is a development of nature.
So they haven't failed their child,
Not at all.
at least at that point. It depends on how they respond to that.
And then they start worrying if they're going to support their prepubescent child or adolescent through an affirmation are they going to be reported to child services for neglecting their child? What is the family? I mean, a myriad of concerns, usually blown out of proportion. Oh my God, how are we going to manage this? And then it becomes more of a fear for themselves than for the child or the adolescent.
So they're concerned of what will the neighbors think?
And beyond that,
Way beyond that, huh?
parents will begin to wonder, what is the future going to hold? The future will have the same options, regardless. The two top surgeons in the country that perform gender affirmation surgical procedures are both affirmed women. Okay? We're out there as professionals.
Yes.
Will have the success that they could have had or would have had regardless.
I agree. I see that all the time.
And it seems like parents are maybe seeing so much politics or social media about the attacks on people who are transgender. I would guess if I were a parent, some of those things might come up. Am I afraid for my child? Is my child safe? Is my child going to have those experiences? I think parents need to know exactly what you're saying, that the opportunities are going to be there.
My life's transition took place 35 years ago. I'm out in public speaking. I work full time. I have counseling clients. I travel. I have not had any problems.
Right.
And as I've shared so frequently, when I transitioned in 1990, I took on female gender identity, presented myself well because I was a woman, and I moved on with my personal and professional life. I didn't get into people's faces.
Mhm.
I didn't make an issue when someone misgendered me because I just ignored it.
I did that same thing in 2015 with no problem.
How you behave will influence how
Mhm.
others will treat you and behave in response.
Exactly. That's been my exact experience.
So let's say a parent or parents comes to you, comes to a therapist, they understand what's going on, they're loving their child, they're affirming their child, whether the child is prepubescent or adolescent. What are some things that parents can do to help ease that child's transition, help them make decisions that are healthy and helpful?
Well, one of the things I like to recommend is first I will ask, has your loved one chosen a name that they want to use once they complete their transition? And if they tell me they have yet to decide on it, I will suggest to them, why don't you sit down with mom and dad and ask them what they were planning to name you before they knew that you were a boy and not a girl? Let mom and dad be part of the naming process. Sit down and even if it may be incoherent, tell them what you're feeling. Tell them what you're experiencing. And mom
Mhm.
and dad should listen with empathy, not trying to fix anything. But of course, research, find support groups, find other parents. Okay? You had the one woman on who was talking about her transgender daughter and how the family accepted the individual. And one of the siblings said, I think I'm finally getting to know who you are.
Mhm.
That is very, very powerful because the familial support, parents and siblings, will strengthen the resolve and resiliency of that individual, whether prepubescent or adolescent, to be able to deal with society's negative aspects much easier.
Mhm. Yeah, to have that home support. Oh, and what about school? What can parents do to help the child make that transition in school?
It's always preferable do the transition over the summer before the next year begins, rather than doing it mid-school year. Prior to summer, the parents should meet with school officials to have the name changed on all the documents, and they do not require a court order for that to be done. School is required to comply. Have the school outline how they're going to support the new transition student when the fall comes. Safety plans, school nurse, to ease the individual in. Now, when it's possible, it's much preferable to do a transition between elementary school and middle school, or between middle school and high school. Typically, it's between middle school and high school. Parents that have had the resources would actually transfer their loved one to a different school after the transition so that it wasn't general knowledge.
Right.
When we're talking about transitioning, we're not talking at that age about surgeries or even until they're adolescent, even talking about hormones, but we're talking about socially transitioning, like you were talking about the name, the appearance. Is that right? Those types of things?
If we're dealing with a prepubescent child who is persistent, insistent, and consistent in their belief that they are a gender which is incongruent with their sex assignment at birth, a social transition would be permissible, where they adopt the name which would be appropriate for the affirmed gender identity, clothing, their presentation to family and in public. No medical intervention, no puberty blockers. They only would be introduced with the commencement of puberty. No hormones, no surgery, purely social transition, appearance and name. It's a great way to see how the shoe fits and feels after you've walked a mile in it. Because
Mhm.
how many times we put on a pair of shoes in the shoe store, they feel great. We love them. And then we try to wear them the next day and they hurt like hell.
Mhm.
Right? It's like, well, they were fine in the store. What's wrong now? The social transition is reversible. It could work nicely prior to going into elementary school or even middle school. Now, with high school, you have individuals that are entering or into puberty already. And if they've been cleared by psychologists and they've had their medical exam, their blood work, bone mineralization studies, and the physician or endocrinologist gives them clearance to begin puberty blockers, gonadotropin releasing hormone agonists, to put a pause on the development of secondary sex characteristics, that would be at that stage, typically following an earlier social transition. Cross-sex gender affirming hormones would not even come into the equation till age 15 or 16. If at that point, prior to 15, 16, the shoe is really uncomfortable, you discontinue the puberty blockers. While delayed, puberty will kick back in. Minimal adverse effect, if any whatsoever, and life goes back to what it was before. But the adolescents that I've worked with cannot wait until they can fully express their affirmed gender. But I caution them about, as Nyla Miller stated in 1999, stay out of affirmation genderland. Don't go overboard. But getting back to the adolescent, they're having blood work and medical exams every 6 months. They're still working with a counselor or psychologist because at that age, they're not thinking about what they're going to do after high school or college. They just want their affirmation to be complete as quickly as possible. And part of the counseling is to help them through, and this is the work I do with them also, is to help them through their gender affirmation, their social, legal, prepare for being a young adult as a woman or as a man, in contrast to their sex assignment at birth, and not get wrapped up in the excitement of, oh my God, the butterfly is out of the cocoon and she is ready to fly.
What do they say? The egg has cracked, right?
Yeah.
Well, and so parents who are supportive have all these things to look forward to and all these things to help their child.
Right. But the parents cannot fully assist child, prepubescent or adolescent, until they have a better understanding of gender diversity, transgender identities from a neurobiology, physiology, and psychological perspective. So they have a foundation of knowledge. Otherwise, they're chasing a ghost in the room.
So this is a process that takes time.
Absolutely.
So what I'm thinking is for parents to give themselves some grace, to allow themselves the time to work with their child. You're talking about listening, active listening, empathetic listening.
And to help
Right.
educate the child or the adolescent.
Yeah.
Now,
They can work together to educate themselves, it sounds
Right.
like.
where I receive complaints from specifically adolescents is, well, you're gatekeeping. No, this is not gatekeeping. This is helping you achieve the gender affirmation you want, and that will make you who you were destined to be without complication. This is not a runaway train. There's a process here, and our role is to guide you and work with you through the process and to keep you focused.
And with the family, especially parents and even siblings, it takes time for that unconditional acceptance to come into play because they have to
Absolutely.
transition with them.
No one transitions alone. I say that so repeatedly. Okay? I had an older sister who embraced my affirmation. I have a younger sister who threw me out with the bathwater.
Mhm.
I mean, I haven't heard from her in 15 years,
Okay.
which is fine. Wow, things happen, you know.
Mhm.
How does the family dynamic impact the siblings, and especially depending on the age of the sibling?
More importantly for the adolescent siblings than the prepubescent, although late prepubescent would fall into the same category. When the parents are going to support the gender affirmation socially or beginning the medical process, the siblings will very easily begin to perceive that this person's getting all the attention of mom and dad, and we're being left in the dust. I always recommend that the siblings are included with all conversation, all discussion. Educate the siblings like the parents are being educated. Keep them involved. Do not isolate them because it's very easy to become focused on what the transitioning child or prepubescent or the adolescent will require because of the urgency of the need, but not intentionally neglecting the other children. But they will perceive that they're being neglected and special favors are being offered to transitioning individual. So they may need counseling to understand. They're going to need education, psychoeducation, physiological education, neurobiological education as to what's taking place.
So what I'm hearing you say is it's not a good idea to hide this from the siblings, especially parents who think that they're protecting their other children from whatever they think they're protecting them from.
They're not protecting them, they're creating a
Right.
problem.
Yeah.
They're
Yeah.
creating a problem.
I'm just seeing this picture of the whole family having discussion and reading things together and different books depending on the age of the siblings and the person who's transitioning. That there are all kinds of resources that they could bring in to have these family discussions.
And no individual's gender affirmation journey is the same as anyone else's. My life's evolution is mine. Wendy's life evolution is hers. Yes, there are going to be significant similarities, but my experiences are different than Wendy's and vice versa.
Right.
So it's not like I am or Wendy would be the blueprint or the template for another individual's gender affirmation.
What about the extended family? At what point, I know, again, I'm going to go back to everyone is different. Everyone has a unique experience, but are there some similarities that in the ways that you tell extended family?
Their parents need to be in for the educational process early on as well. I believe I might have shared this story, but family I'd worked with, transgender son, currently in their 20s, the grandmother refused to accept the affirmation, continually dead named the individual, would continually buy female clothing and accessories, perfumes, and soaps. And it took 2 years. But what cracked the grandmother's egg, per se, is she was at the hairdresser having a conversation with her stylist. And somehow or other, the subject came up because the stylist has a transgender niece. All of a sudden, the grandmother and the stylist had common ground for conversation. And the next thing you know, grandma is now fully supporting the grandson and bought a polo shirt that had the transgender flag on it, brought it to the mom and said, "Do you think he would like this?" The mom said, "He'll love this." And the fact that his grandmother was now accepting him, it can take time. This is where having a stakeholder like Wendy and myself work with the family is so valuable. Having the parents meet the parents of other gender diverse and transgender individuals to hear their stories, to learn how they adapted and managed and brought the family on board and the challenges that they faced and were able to overcome. It's very helpful.
Having that support system,
Absolutely.
as wide a support system as you can find.
And there are tremendous resources available that do not take a lot of energy to find, which is why the appendix, I included an entire section on finding those resources, as well as other books and websites for credible information. No one transitions alone. I cannot say that frequently enough. The parents, the siblings, the extended families all become part of the evolution of that individual's life journey. How well they adapt, how well they support, how well they accept and love the individual will be predicated on how informed they become and how frequently they can access individuals who've been there. Many times, physicians will refer clients to me. These are adults who are transitioning. And I hear the same theme over and over. I told my doctor I wanted to work with somebody who has been there, done that, and is living it. I have a great psychologist, but he or she has not been there, done it, lived it. I need to spend some time working with someone who has, walked the mile per se. And my phone rings. And those are the individuals that usually only meet with me 3 to 5 times because they learn what they need to learn from my experiences, return to their psychologist, which is fine. And they're empowered to move forward. And I remember one individual, a gentleman in his 50s, he was struggling with this dichotomy of male, female, male, female, male, female. He was presenting male, did not provide pronouns that were contrary to sex assignment at birth, was he, him. And I asked him, what do you want to do? What is your goal here?
Mhm.
I really want to transition because I'm a woman, I'm not a man. I have a fiance who knows what's going on. She's supportive. We're going to live together, get married, but I'm struggling between these two elements. To which I replied to him, I said, why are you struggling? I said, you're a hybrid. I'm a hybrid. I'm presenting fully as a woman, but when necessary, I can tap into that pesky Y chromosome when the situation warrants it. I said, so you don't have to worry about the dichotomy. You're a woman with a plus sign.
Mhm.
And I could watch the light bulb go off in this individual's head. He goes, that's powerful. I said, yes, it is.
Well, as we're talking about adults, let's move into discussion about partners. So someone's married to a person and all of a sudden, maybe they have warning signs, maybe not. What happens?
That is the quintessential quagmire of relationships. More frequently than not, an individual has been married to their partner, an individual who's transitioning male to female. They have a female partner. They're married 5, 7, 9 years. And through childhood or adolescence, or maybe it didn't peak until late adolescence, early adulthood, their gender incongruence. They kept it to themselves. They repressed it. They suppressed it. They did not share it with their partner before or after marriage. But then it reaches a point where the pressure cooker can no longer be contained. And they come out and say, not a man, I'm a woman. I want to pursue gender affirmation. It throws the partner into a tailspin of emotional distress, anger, fear, betrayal. You know, why didn't you tell me this sooner? Okay? And if the partner is willing to support their partner, the cisgender female support the transition of the male to female, she will begin to reevaluate her own gender identity. And in many instances, she'll become hyper feminine to reinforce her own gender identity. And then the thoughts will become, well, if we stay together, does that make me a lesbian? And now it becomes an assessment of sexual orientation, sexual identity, in addition to her gender identity. All too frequently, the male to female partner is ready to move full speed ahead without spending time to allow partner to develop an understanding of why it was suppressed and repressed for so long, why they were unable to share this earlier in the relationship. Unfortunately, they become selfish as they pursue their affirmation, neglecting the emotional concerns and the identity concerns of their cisgender female partner.
Mhm.
More frequently than not, what I've seen is female partner will support the male to female transition, but once it's complete, the marriage is over because it's not what was in their cards. Now, there was a woman I worked with, a trans woman from the UK, married 9 years before the transition. Cisgender spouse supported the transition. The spouse was pansexual, so she could go either direction, and was willing to remain in the marriage after transition. And in my counseling with the individual who was transitioning, I said, avoid affirmation genderland. Don't go postal with the joy and jubilation of finally being able to spread your wings and fly. Well, that's not what she was willing to do. And she came out like gangbusters. It didn't take long before the wife said, this is no longer for me. I was willing to work with you. I was willing to stay with you, but your behavior now is beyond acceptable from myself and my future. And the marriage was over.
So like any relationship, there are things to be worked out mutually or not. And if people are selfish about it, regardless of which of the partners is selfish. If they both are, that makes it a lot more difficult.
And it's not just the male to female individual transition, it could be the female to male, because the dynamics will be the same for the cisgender partner. Female becomes male. That means the male partner is now gay. The male partner will have to reassess their own gender identity, sexual orientation, and are they going to remain in this relationship? But all too frequently, when the affirmation begins and they feel like they have a clear road ahead, they literally become very selfish and do not include the partner in all that's taking place and is not respectful of the partner's needs and emotions and the complications this is bringing to the relationship on the partner because they become so focused on themselves.
Have you seen relationships that have survived this? And if so, what does it take?
I know of one relationship that has survived it. Affirmed woman who was my electrolysis for many years, remained with her spouse, her female partner, and the female partner stayed with her because the bond they had was stronger than just the gender identity. And her partner, this gender female, was included in the counseling session, in the information session, in the learning curve, began to develop an understanding of the emotional and psychological trauma that her partner had gone through for so many years to get to this point, and developed a level of empathy for her partner. And it allowed the foundation for the two of them to remain together.
So how does a cisgender person understand what all this is? It sounds like it would take years of therapy to really understand that.
It did not really take years of therapy. It's spending some time in therapy, a lot of conversation with the partner. The conversation may not be an easy conversation for the transitioning partner, but be open, be candid, be raw. Don't try to polish what you're sharing. Let them know what you're feeling and what you've experienced so much of your life. There are individuals who will realize in their 20s that they're gender incongruent from their sex and sign of birth. They just felt different throughout prepubescence and adolescence. Maybe had an inclination that maybe something was different, but it didn't hit them hard until their 20s. Everyone's life through their evolution is different. There are no two stories the same. As I shared earlier, there are commonalities, but every evolution is totally unique, especially their experiences prior to their evolution.
Well, if they've been hiding something for all these years and not talking about it and doing whatever they have been doing to compensate for it, then to all of a sudden be able to just freely open up and even examining it all in their own head, what's been going on with themselves, but to be able to open up and share that with people who have only known them before transition, that seems like that would be a difficult thing to do.
It's very difficult, and in many cases, it's traumatic. There was one spouse I worked with, cisgender female partner, who adapted pretty quickly and easily. What she said to me one day in one of our one-on-one sessions, she said, you know, I knew there was something different when we met, the way I was treated by my partner. It was very atypical for men I have dated prior to meeting my partner. And when it came out that she was transitioning male to female, for me, it started to make sense because my partner was treating me more like a woman would treat me than what a man would treat me. And I loved it because there was a connection, there was a love, there was a level of intimacy that I never experienced before. For her, it made it very easy to remain in the relationship, and they're still together. That's the exception, it's not the rule.
And what happens when there are children involved in a family?
The toughest time are for the adolescent children. They're going to be embarrassed. They're afraid of the stigma and the bullying and the harassment that they may experience from their peers. They don't know what's going on. They do not have anyone to relate to. They do not know any friends who are gender diverse or transgender, or friends with a parent that is transgender. So it takes an emotional toll. They need the information, they need the training, they may need the counseling as well. The adolescents tend to have the more difficult time. Prepubescent children over the age of 7, they have their challenges as well. Not as bad as the adolescents, but they have their challenges. Younger children under the age of 7, not so much so. So again, there are many dynamics that will come into play. The relationships with the parents to the children to begin with, the relationship with parents throughout the transition. Now, here's another caveat. If partner is not supportive of the transition and tensions build and problems develop between them in their relationship, it spills over to the children in the family.
What happens when somebody transitions later in life, like say in their 40s, and they've got teenagers or younger people in their 20s?
Younger adults outside of the teen years, outside of adolescence, they'll either accept it or it won't. It takes time, but they're living their own lives at this point.
Mhm.
And it's not really a big issue for them because they're not having the day-to-day contact that they had earlier in their lives.
Right,
So it can go either way as far as acceptance or rejection.
right.
Wendy, you experienced it. I've
Yes.
experienced it.
In my
Some
own situation with my spouse, she knew about me after we were married for 4 years. It just came out. And there was nothing I could do about it in the later 1970s.
where it really becomes overly traumatic as far as potentially destroying a relationship is when partner by accident finds out about cross-dressing or the experiments and it has not been voluntarily disclosed.
Well, mine agreed after about 2 or 3 days after I told her. She said, "You can cross dress." I did try it. I hated it.
Well,
I hated taking everything off. It reminded me of who I couldn't be.
yeah.
And I'd already been told by a psychiatrist that I was a freak.
Yeah.
So it wasn't until later life when my diagnosis I found out changed and that there was now therapeutic medical support and all of that. That's when I told her, "Remember what we talked about?" And she said, "Yes." And that's just led to a very quick transition for me. And we agreed, divorced amicably. She said unconditionally she's not staying in a marriage with a woman, period. And that was the end of it. And we were both fine with it.
And that's common, whether it's male to female or female to male. That is more the norm that is experienced.
And I had no problems with it. I've been asked by other transgender people, "Well, didn't you love her?" I respond, love had nothing to do with it.
Yeah.
Yes, we still had feelings for one another, but we grew apart and I was doing something she wasn't willing to accept, and that's okay.
She could not accept being in a lesbian relationship because that was not her orientation.
Exactly.
Okay? And if she stayed with you, which is the case with so many relationships, they start questioning their own identity. And it's just for the majority of them more than they want to deal with.
Mhm.
They may love you to death, but you know what? This shoe does not fit.
Well, the other thing that I've seen too, I've seen it and I would have experienced it had I tried to stay married and tried to give it more time and kind of coax the whole thing along and maybe even force it, like some people I know have done. Um, it it actually would have compromised my own transition. And she admitted this to me 5 years later. She said, "It's great that you moved away, did this on your own. You would have never transitioned as well because we would have had to discuss and debate everything you were going to do. And I said to her, thank you for telling me that, because I knew that would have happened with us. And I was not willing to compromise anything on my relationship. This is my life, and I was determined to live it my way.
Have you seen that a lot with other people that you work with, Dr. Sorrentino?
Absolutely. I mean, it's the norm. It is absolutely the norm. And let's take it a step further outside of marital relationships. I'm single. I date, and I had met a woman. My orientation is lesbian. We got along great. We would have conversations for hours, whether in person, over cocktails, on the phone, texting. And then one day she looked at me and she goes, "You're trans." I went, "Yeah. Well, I only like real women." And
Oh,
Exactly.
after
And-
all the time.
yeah, after over 3 months and so much time together. And my only response to her was, "I had no idea you were that shallow."
Oh, ouch.
All right.
But yeah, that's obvious there, isn't it? So there's something in her background and society or where she's living or something.
You know, we had been intimate. I mean,
Mm-hmm.
Yeah.
I wasn't, I'm not wearing it on my sleeve.
Exactly.
So, just one day she goes, "You're trans."
Mm-hmm.
Well, actually, I'm an affirmed woman.
Exactly.
And
I like that.
she goes, "I only like real women." And
Yeah,
at
but
that
she
point,
liked you.
right, but I'm not a real woman in her mind.
Yeah.
And that was the last time we had any contact with one another.
No, but it's
That's
so
life.
interesting that somebody can just turn on a dime like that with one piece of information or something that just negates the whole thing that came before that. It's just, it's
I'm not at all
surprising to me.
surprised by it.
I'm not surprised. I'm just,
This is where the pathologization comes in, the hyperbole, the myths. They don't want to understand.
Mhm.
no, they don't want to. Yeah. One question that keeps coming up that's a little off topic, but why is it that there are more trans feminine people than trans masculine? Is that just the people that we're working with and encountering, or is that really a statistic?
It's not a statistic.
Okay.
At one point, 30 years ago, 40 years ago, yes, it was a statistic. 3-to-1, 4-to-1, male to female. Today, it's 50-50. It's
Is
just
it?
that the trans men tend to very quietly move on with their lives
Exactly.
in their affirmed gender identity.
Mhm.
The city of Philadelphia has a trans male police officer who
Mhm.
went through the police academy and was supported and encouraged by all the other candidates in the academy. And it was a big celebration at the end. So the city of Philadelphia has a trans male police officer.
Right.
Oh,
And
that's-
my endocrinologist in Yardley, Pennsylvania, told me when I last saw him before I left PA, he has more trans masculine patients than trans feminine.
Hmm.
They
And
remain quieter, they get on with their life. The ones that I've worked with, where they feel uncomfortable because many still have their female components, vagina and uterus,
Mhm.
when they go to the gynecologist. You know, here's this man sitting in the waiting room and they feel awkward.
Mhm.
So my response has always been, "You mean you're not the male spouse or partner waiting for their female partner to finish their appointment?" A lot of it is just how are you looking at it?
The
This
mindset.
one individual is getting so worked up emotionally about going to the gynecologist because he has a full beard,
Right.
looks terrific, and was more concerned about what the other patients in the waiting room were thinking when none of them were paying any attention to him.
Exactly.
You're just waiting for your partner to come out from her exam
Mhm.
or
Well,
being invited in because the doctor wants to speak with you with your partner. I mean, what's the big deal?
And I don't hear people losing their minds over transgender men in sports.
Right.
Do they think they're just weak so that they aren't competitive?
Yeah. I mean, society has an issue with affirmed women.
Yes.
It's about women, isn't it?
Yes.
And as far as affirmed men are concerned, it's like they don't exist. It's not an issue. We don't hear about them.
And they blend into society so easily, so readily. Voice changes, the facial hair, hairy arms. I've met many transmasculine people, and unless you know personally about them, you can't tell, and you never will guess.
A psychologist who works in Ballackinwood, just outside of Philadelphia,
Mhm.
an affirmed male. And I met him. Had he not shared with me that he was an affirmed male, I would have had no idea.
Exactly.
And we're not so lucky, but they are.
Yeah, well, women aren't as lucky in a lot of different ways.
That's true.
Also,
That's true.
too, a lot of people have always asked me, you gave up your male privilege.
What privilege.
I know. That's my response. I never considered it to be a privilege. But
Yeah.
when they look at transmasculine people, and if they know, oh, well, they became men.
So they bought their mail card, is that it?
That's right. They've
Their
picked
mail
up the
card?
mail card.
Oh, crazy. So we've talked about parents, we've talked about partners, we've talked about siblings. Is there anything else you want to add to the conversation today, Dr. Sorrentino?
Well, in our programs, this one and the previous, and any future ones we might do, you have to understand we're speaking in generalities. I can speak specifically about certain cases and individuals I've worked with, but no two developments are the same, whether it's from prepubescence, during adolescence, young adulthood, middle adulthood with adult children, partners. We can talk in general terms, but no two developments are the same. Everyone's life journey different. So much depends on the personalities of the people involved, especially the parents and the partners.
Well, and it seems like it would depend on how someone grew up and how someone was treated earlier in their life.
Mhm.
That would be an influence on how they transition and how they handle some of these things.
Most definitely.
There's a lot to it. It's not just one particular thing. And thank you for pointing out that everybody's an individual. What a concept, right? It's so hard for people to understand that.
Before I meet with an adolescent who's transitioning, I do not work with prepubescent children. There's no need to work with them. But when I meet with the parent or parents, I want to know what the child or the adolescent's life experiences are within the family. That will impact the effectiveness of any support parent or I can provide the individual. And then when you have one parent who's supportive and another parent who wants to maintain the stereotypical gender status quo, it really creates a dilemma for the individual who's going to be transitioning. The prepubescent who's on the cusp of puberty, or the young adolescent who's entering or working through puberty, the lack of combined support for the two parents weighs heavy on that individual. And I see this too frequently.
That's sad, but it's reality, isn't it?
Well, it's life, it's reality. The problem is, as parents and even as adults, our behavior and our interaction with others begin as learned experiences in our youth from our parents based on their experiences through their youth, and it becomes a perpetual cycle. Now, there's a phenomenal book. It's entitled Complex Trauma and Dissociation in Childhood. Prepubescent children and even adolescents who experience physical, sexual, emotional, psychological abuse or simply neglect in their early years, the negative impact it has on them long term. I mean, the book's about yay thick. That's one of the books that took me a month to get through because it was such heavy reading, but it was extremely powerful. It's complex trauma and dissociation in childhood.
Okay, we will put that in the show notes for anyone who wants to do that research. So,
Yeah.
So what a great conversation today. Wendy, did you have any other questions before we get Dr. Sorrentino's contact information?
I've really enjoyed our conversations together so far, and this has been phenomenal. Thank you.
And that's what it is. It's a conversation,
There you go.
not me providing a lecture off the cuff. It's ad hoc. It's not scripted. And we go with the flow based on your questions and scenarios.
Mhm.
Well, and wherever the conversation leads us, and it's led us into some very fascinating topics today. So very educational, very enlightening. And thank you, Dr. Sorrentino.
And for
spending
those
the
who are
time.
just learning and becoming familiar with demystifying the transgender journey, it's a starting point of knowledge.
Exactly.
Like my podcast series, I now have subscribers in 83 countries. The hunger for credible knowledge
Yes.
is global.
Mhm.
People want to know, and that's why we're so grateful that you're spending time with us and sharing all this so that we can educate people.
Absolutely. Thank you.
And our conversations and the information you list in the notes section
Mhm.
steers them to more information.
Mhm.
Well, share with us your contact information, your podcast, your website.
Website is paradoxesofgender.com. Or if you go to Google and you put in Dr. Diana Sorrentino, you'll get dozens of pages with information on podcasts, my speaking engagements, my website. On the website, you'll have direct access to all of my podcasts, as well as additional information. I'm also on LinkedIn, and you can find me on Dr. Diana Sorrentino on LinkedIn, where I post content from time to time. So I'm out there. And if you want to email me, it's paradoxesofgender@earthlink.net, or you can connect with me through LinkedIn. The website has a contact page where you can email me, blah, blah, blah. I'd love to hear from you if you have any intelligent questions.
Well, and don't forget her book, Transgender Families. Find that on Amazon. That's an amazing book. As you can
Yes, it
see, I
is.
got my little flags on there for all the things that I want to talk to you about. And Dr. Sorrentino, we're going to do our best to entice you to come back again because
Well,
there's still more that we have to talk about, I know.
you can twist my arm.
All right,
Thank you.
we'll twist your arm. So to our audience, thank you for joining us tonight. On behalf of Wendy Cole and me, Lynn Murphy, we really appreciate you being here, spending time listening to this, taking it in, and spreading the word. It's important. We're trying to educate people. That's our goal in this podcast, and it's turning into our goal in life is to educate people about what it means to be born transgender. So subscribe, hit that notification bell so that you get notices when we release a new episode. Like us and share this out with people who need to know, who want to know, who are open-minded enough so that we can plant some seeds and change things in the world, the direction we're going. And you'll also find us on thetransgenderjourney.com. So be sure and subscribe. Thank you so much for joining us tonight. And remember, until next time, stay curious and stay kind. Thank you for joining us today on this episode of Demystifying the Transgender Journey. Remember to subscribe so you don't miss a single episode of our fascinating interviews. You can also find more information on our website, thetransgenderjourney.com. So until next time, stay curious and stay kind.